Hi, this is Susanna, certified nurse midwife and owner of the Villagers Women's page. What do I do as a midwife? I take care of women and help babies out. So today I wanted to come on to talk about two issues that are quite challenging for women in the first trimester of pregnancy. There are complications that women do face and can be devastating and also heart-wrenching for the providers that are taking care of them. So the issues include miscarriage, one, and second is ectopic pregnancy. Miscarriage, I would define as involuntary loss of pregnancy or involuntary termination of pregnancy. That is very common in the first trimester. About 20% of pregnancies end in a miscarriage. Causes of miscarriage include chromosomal abnormalities, lifestyle, medical history, and also age. Caffeine intake as well has been linked to double-fold increase in miscarriage, even though the evidence is not as strong for caffeine. Chromosomal abnormalities. So about 50% of miscarriage is actually grouped into this category, grouped into the unknown or chromosomal. We assume that is just from the chromosomal abnormal formation during the time that the egg and the sperm unite. And then other causes, as mentioned previously, include lifestyle, so heavy smoking, heavy drinking, heavy alcohol intake. There are medical conditions as well that could potentially increase your risk of miscarriage, and those include elevated or uncontrolled high blood pressure, uncontrolled diabetes. Age has also been linked to increased risk of miscarriage mainly due to the chromosomal abnormalities. So women over the age of 35 are at increased risk of miscarrying than younger women less than 35. So how do we diagnose a miscarriage? Number one sign that one is having a miscarriage after having a positive pregnancy test is bleeding. So most women tend to bleed heavier. It just doesn't seem like your period type of bleed. So most women would come in for that complaint of heavy bleeding. Some would pass blood clots as well with the bleeding. There are women that would experience pelvic cramping as well with the bleeding, because it's your body's way of trying to expel the content of your uterus. There are women that would actually not know that they're miscarrying because they didn't even realize they were pregnant. Most times they will come in with a complaint again of heavy bleeding, heavier than their period, maybe feeling dizzy or lightheaded with bleeding as well, and unusual type cramping too. So what do we do when you come in for possible miscarriage? We first of all want to ensure that your blood pressures, your vital signs are stable. So we want to check your vital signs, make sure that your blood pressure is not very low. And then we also want to get some blood work, check your blood count to see if you've lost blood. Another thing we'll do is to check your blood type. So for Rh positive blood type, we do give a shot called Rogam that I can discuss in another video. But yeah, so if you have a negative blood type, Rh negative we call it, we give you an injection to prevent future reactions, to prevent reaction, or what we call isoimmunization with future pregnancies. If you suspect that you're having a miscarriage, if you've had a positive pregnancy test and suddenly you're bleeding heavily and or even maybe just spotting, if something doesn't seem right to you, you want to try to seek medical attention as soon as possible. In the event that you're bleeding and saturating more than a pad an hour within a 2-hour window and passing clots at the same time and feeling dizzy, if you have other symptoms like dizziness, lightheadedness, and you feel short of breath, if you do not feel well, you probably will want to go into the emergency room at that point. But if you feel stable, if you seem stable, meaning if it's spotting, even though if it doesn't seem normal for you, you do have time to contact your OB provider or a midwife, contact the nearest clinic. But again, I stress, if you're having heavier periods, if you're soaking through a pad an hour and it's been 2 hours or so, 2 or more hours, and you're not feeling well, you're feeling dizzy, lightheaded, short of breath, that would be a good time to contact an emergency room. So some women do tend to blame themselves after a miscarriage or while they're in the process of having a miscarriage. One thing I want to encourage you is to not blame yourself. In most cases, miscarriage, there's no reason. We don't have a definitive reason for miscarriage. Most times it's just your body's way of expelling a pregnancy that was malformed. So do not blame yourself. I know it can be devastating. Even if it's not a planned pregnancy, it's still quite devastating to go through a miscarriage. But don't blame yourself. And one question I get is, what does the future look like for me in terms of childbearing? Will I be able to have another baby in the future? Will it be difficult for me to carry again in the future? Or will this happen again in the future? Yes, you will be able to conceive again if you don't have any other reasons that would preclude you from conceiving. So that should not be a concern. As far as if it's going to happen again in the future, it's really difficult to tell. Depends on how the pregnancy is formed in the future. It's really difficult to determine until it's happened. But one thing I would recommend is if you've had a pregnancy loss at least 3 times in a row, it's a good time to talk to a provider to get in touch with a GYN doctor, because at that time they want to consider doing some blood tests and doing some checkup to see if there are any other links, any genetic link to you having multiple miscarriages. At that time, we consider you a habitual aborter. I know that sounds harsh, but that's the medical term we use for it. Yeah, so it'll be a good time to contact a GYN doctor to discuss testings, as far as genetic testings go, because there are some genetic conditions that would increase your risk of miscarrying as well. So yeah. Be kind to yourself if you're going through this. Know that it's not your fault. Know that there's so many women out there. It happens to the best of us. There's so many women out there that have gone through the same. Know that it doesn't mean it's the end of childbearing for you. It just means that it's nature's way of taking care of, and in most cases, an abnormally formed pregnancy. Because of the increased risk of miscarriage in the first trimester, most women tend to cover up their pregnancy or hide the news of their pregnancy until at least the second trimester, which is around 13 weeks. Because after 13 weeks, the chances of having a miscarriage decrease. The second complication of early pregnancy that I want to talk about is ectopic pregnancy. The second complication of early pregnancy that I want to talk about is ectopic pregnancy. Ectopic pregnancy affects about 2 to 3% of all pregnancies. Ectopic pregnancy is a pregnancy that's implanted in other parts of the body other than inside of the uterus. So the most common place that an ectopic pregnancy implants itself after fertilization is in the fallopian tubes. About 97% of ectopic pregnancies are found in the fallopian tubes. So that's the tubes that are connected to the body of your uterus. A classic symptom of ectopic pregnancy after having a positive pregnancy test is pain. So most women experience pain on one side, mostly one-sided pain. At times you would also have some bleeding with the pain. Again, the classic symptom of ectopic pregnancy is pain, severe pain, mostly one-sided. If you're noticing any pain with bleeding and you know you have a positive pregnancy test, please seek medical care. Seek medical attention, because it can quickly turn to an emergency if not taken care of immediately. So when you go into a GYN provider or a midwife's office to be evaluated for ectopic pregnancy, the first thing we want to know is the location of the pregnancy if that hasn't been determined yet. So we do an ultrasound, checking the uterus to see if there's a pregnancy there with a positive pregnancy test. And if there's no pregnancy in the uterus, our first inclination would be to check for ectopic pregnancy. In most cases, you won't be able to see a pregnancy in the fallopian tubes by ultrasound. So we look at the levels of your pregnancy hormones to see how well they are rising. Normal pregnancy hormones should have a double fold rise every 2 to 3 days or so. But there are some cases where if it's an emergency and if we're highly suspicious of an ectopic pregnancy, you probably won't even be waiting 2 to 3 days to see if the pregnancy hormones are rising. And there are ways to treat ectopic pregnancy depending on the location and also the location of the pregnancy, and also the age of the pregnancy, because there are some pregnancies that are like at the junction, so somewhere around the junction of the fallopian tube and the body of the uterus. Again, the most common location of ectopic pregnancy is in the fallopian tubes, but there are some unusual locations as well. So again, treatment depends on your medical condition first of all, and also location of the ectopic and the age of the pregnancy. Well, I hope you find this video helpful. If you like what I do and if you want to encourage me to continue, please consider subscribing to my channel, and I hope to see you in my next video. Bye.